Hey there, good morning, and thank you so much for joining our Facebook Live discussion here on the WMAR2 News Facebook page. I am Megan Knight with Good Morning Maryland. And, October is National Breast Cancer Awareness Month. So we are going to be talking about breast health, breast care, and the best practices because, breast health is more than just going out and getting your annual mammogram, which of course you should do. But it's really this whole self approach to caring for yourself as a woman and really requires a dedicated mindfulness about your well being, not just your body, but your mind and your spirit as well. So, I've got two fabulous ladies here with me to help us learn all about the essentials of breast health and holistic breast care. So, I'd like to introduce Ginny Jump, who's a nurse practitioner and a survivorship coordinator with the Barbara L. Posner Wellness and Support Center at the University of Maryland St. Joseph Medical Center. And also joining her is Susan Field, who is a breast nurse navigator with the St. Joseph's Breast Health Center. So good morning, ladies. Thank you so much for joining me.
Hi there. Thank you.
All right. Well, let's just jump right into it. Oh, and by the way, if you are watching our Facebook Live discussion and you have any questions for Ginny or Susan, please leave them in the comments section and we will address them throughout this conversation. So let's just jump right into it. We mentioned the word holistic, and I think sometimes that conjures up lots of different ideas of what exactly that means. So maybe, Jenny, could you kind of define for us or explain exactly what a holistic approach means, whether it's breast health or any other part of our healthcare?
It's absolutely. And holistic is the whole person. So bringing in the patient to have assess their physical, their emotional, spiritual, social, financial, all of those things that make up that person's health and well-being, and not just their breast. Right. So, bringing them in and doing that to make sure that they have, we just treating the whole patient. We find that it just gives much better outcomes to their care. So that's a holistic approach to their care.
Very good. So in terms of focusing on our breast health, is there anything like more specific when it comes to holistic care, or again, just kind of making sure we're taking care of everything doesn't necessarily have to just be about our breast health?
Absolutely. And so with Susan and the Breast Health Center, they refer patients up to our Wellness and Support Center. And so we work together to have that all come, for the patient to, again, their physical, emotional, spiritual health. And when they come up here, we have different resources and things that they can access to help them. And we do an assessment. There's a NCC and distress screen tool. It's a validated tool that they rate how they're doing. And then there's different domains, the physical, emotional, those kinds of things. And then from there, between the Breast Health Center and all of the Cancer Institute, we're all able to better address that whole person and make that a better experience that, again, has better outcomes for breast health.
Very good. And maybe, Susan, if you want to talk about the holistic approach in terms of when patients are coming to you, if they have breast cancer
Yes.
and they're doing treatments, how do you kind of incorporate the holistic approach in their treatment plans?
Thank you for asking. So, what we do is for all of the gals and sometimes gentlemen that present to our breast center and are diagnosed with breast cancer, for all of those folks, we make a referral to the Wellness Center, bar none. And we say these opportunities are available to you today and anywhere along the continuum of your treatment plan. And so we love that Ginny, as well as the whole team up here in the Wellness Center, including a dietitian and a social worker and a nurse that does healing touch. We do yoga, we have acupuncture, we have massage, and all of these opportunities are available to the patient. Just like Ginny had just mentioned, we do utilize something called a distress screening tool, which allows us to determine some of the patient's immediate needs. And I get in touch with the Wellness Center and I make suggestions. And I ask the patient, I know we've made this referral, but have you had an opportunity? Upon diagnosis, there's so much going on. And so we know that it's on their list to come up to the Wellness Center, but it's not always their first stop. Sometimes I walk a patient up. just the other day, after the appointment in the breast health center, I said, I caught up here. There was some availability, and I escorted the patient up here for healing touch. And I knew that that was going to be really helpful to help to decrease some of her anxiety and help to calm her down.
And she did. When she left, she felt much calmer. She had met with Kathy Fritzie, our holistic and integrative nurse, and had that healing therapy, healing touch session. And her daughter was here waiting while she had that. And she came out and she was much more relaxed, much more able to process all that's going on. I think that's what helps when we have this holistic approach, you know, decrease the stress a little bit, be able to understand, again, what's going on and how you can best approach all of this.
Absolutely. Because I think when we think of getting a breast cancer diagnosis, oftentimes we just go right to the treatment, right? The chemo, the radiation, all the, I guess, those kind of medical aspects of it. But, you know, is it important to make sure that your mental health is doing okay? Will that impact how your treatment goes with chemo or radiation?
No question. And, you know, for me in the breast health center, as the breast navigator, knowledge is power. And we know that patients, upon diagnosis, hear very little of what is shared with them. It's just it's hard to take it all in after you hear that word cancer.
Yeah, there's actually, there's a statistic that shows you only retain 25% of what you're told in a doctor's appointment. So that could just be a normal doctor's appointment. Imagine if it was what, you know, these patients are hearing.
And so we, as a team, and it's not just me in the breast health center or Ginny in the wellness center, but it's a whole team that we hold our patients' hands and we get them through this process one step at a time. We say it's a Mount Everest and you can other, and they're not alone.
Yeah, absolutely. Well, like you said, the whole team aspect there, not just in those who are dealing with breast cancer like they are, but to have all that support behind them, I'm sure is really critical in their treatment and their recovery process as well.
Megan, also here at the University of Maryland, St. Joseph's Cancer Institute, we're in one building. So the entire Cancer Institute has this holistic approach. We all understand how we work together. Susan also refers patients to the rehab center that's across the hall from the wellness center for lymphedema evaluations pre-op and then in increments post-operatively. And then on the ground floor, there's radiation and medical oncology on the first floor. And again, we all work together to assess the patient and see where they need different support.
Well, and I'm sure that helps people's stress level, not having to, like you said, even just jump from one building to another, to know that all of that is there centrally located. So if they need to go see one person and then another, it sounds like you just have to walk across the hall sometimes and you're right where you need to be.
The beauty of the multidisciplinary program that we have here is that for every patient that presents to us, we present their case at our multidisciplinary conference, where all of the folks here at St. Joe's that have anything to do with the treatment of breast cancer are involved in reviewing the specifics about the patient's breast cancer. And then everybody puts their 2 cents in as to the best way to treat the patient. And so it's not just making a decision in a bubble as to the best way to treat the patient, but there's so much input from all of the disciplines, including Ginny. And so we have the wellness team that participates in conference, the physical therapy, the rehab services, the medical oncology, radiation oncology, pathology, radiology, surgeons, genetic counselor, the dietitian, the social worker. And so we're all involved in the patient's care, which is really special.
Sure. And I feel like, too, that makes it more personalized, right? Because not every person's journey is the same when it comes to breast health or dealing with breast cancer.
Correct. There's no question.
Yeah. So therefore, you have all these people who are looking at what's best for you, not best for women in general or your age group in general.
Exactly.
Very good.
Something else that I'm sorry to interrupt you, but I feel privileged because I'm the coordinator for a program that we have here. It's called SOS, which stands for Survivors Offering Support. And we offer this to all patients. Not everyone really is interested, but I can connect a newly diagnosed patient, and it actually doesn't need to be a newly diagnosed patient, but any patient along the continuum with someone who's had a similar journey, someone who's been there, done that, who can say to, one to the other, I know what you've been through, and so I'm here to support you. And so that we find to be really helpful. And sometimes if a patient initially says to me, thank you, but no thank you, and Ginny meets with the patient and makes
Bring it up again.
Yeah.
Did you talk to Susan? Of course they talked to Susan. Did you talk to a mentor? I don't really know. I didn't, hear all that. So, and then we just repeat it. And a lot of times people are very interested to make sure that meet with the mentors.
Yeah, and
which is so helpful.
To work at their pace, right? Like you said, there's so much coming at them right now. They've got so many different things to think about. So, maybe at that moment they're not thinking about that particular aspect of their care, but kind of that gentle reminder of like, just so this is available. And then the day that they're ready to accept it, then it's there for them.
Exactly. And Susan does an amazing job at training these mentors. She has a training session with them and goes through so much that they need to know about. I mean, they have their own personal experience, but then they know a little bit more about cancer, the breast cancer, the different types of treatments. So it's a really very, very strong program.
That's wonderful. We do have a question for you ladies, and this is certainly something that I think we all just need reminders about. Lisa wants to know, at what age should a woman get her first mammogram, and should teenagers be included in this conversation? So what are your thoughts on that, ladies?
So in terms of getting a mammogram, it really should start somewhere around the age of 40 years old. By that time, most women are seeing a gynecologist or a primary care physician, and they can have a discussion with their physician as to when the physician, it's a discussion, thinks it's appropriate. But at 40 years of age, I like to suggest that women become familiar with their breast, what lumps and bumps make up their breast. Everybody has lumpy breast tissue. But if you become familiar with what lumps and bumps make up your breast, God forbid if something were to change, even before 40 years of age. So for the teenager, we don't do mammograms on teenagers. But if there was a concern, run off to your doctor and have a doctor do an evaluation.
Sure. Better to be cautious than to let something go.
Absolutely.
All right. Well, thank you for that question. And by the way, if you are just joining our Facebook Live discussion, welcome. We are talking about breast health and holistic approaches to breast health, as it is National Breast Cancer Awareness Month. I've got these two wonderful ladies who are just a wealth of knowledge. I have Ginny Jump, who is a nurse practitioner, survivorship coordinator at the University of Maryland St. Joseph Medical Center, and Susan Field, who is a breast nurse navigator at the Breast Health Center there at St. Joseph. So please, if you have a question for them, don't be shy. I won't say your name, but we'll ask these ladies their thoughts and expertise on that. And we've been talking a lot about the holistic approach to care. Are there any risk factors, I guess, that come with this, or anything that people need to be mindful of as they go on this journey?
Great question. And the idea of these holistic approaches are integrative kind of treatments or complementary kind of treatments, which include even seeing the dietitian, behavioral health counselor, the yoga, acupuncture, massage, healing therapy. All of these things are generally, of course, safe. The yoga, acupuncture, they're things that have been practiced for thousands of years. And they have shown over that time to be beneficial in different ways, and then to not have too many risks. Now, we have patients that are significantly immunocompromised, and at that time, they may want to be careful about different things. So talk to their provider. And then a lot of times people also want to try some supplements, some herbs, some different types of diets. And maybe it's not the right time to be doing that because you don't want to stress your body out when you're going through some of these things. But the great thing about our center, the whole Cancer Institute, and specifically the Barbara L. Posner Wellness and Support Center, is that we have a lifelong access to all of these types of things for patients. So a lot of times patients, as they are done their active treatment, they're in a transition and they sometimes don't know what to do. And that's why we're here to sit down with me, go over how they're doing, and then talk about the different things that we have here that could be helpful or that they might be interested in. And we find, not just our center, but studies out, scientific studies and research show that they cause lasting effects to lifestyle changes with that support, that ongoing support. And that's just incredibly important because that, gives an overall better outcome to cancer treatment, breast cancer treatment, and all over health and well-being.
Very good. So this isn't a situation where once I'm done with my treatment, then I never see you guys again. It's something that I can continue with even long after I've gone through the treatment.
I learned when I first started working here that breast cancer really is not just being diagnosed and going through treatment, but a really, 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 really important and significant part of cancer care is the survivorship portion of breast cancer or any cancer. We also have the opportunity, Ginny will provide something called a survivorship care plan to our patients. So she's really involved from the moment of diagnosis and probably for a very long time because survivorship is forever. And so, we're really so lucky to have this wellness and support center and all of the different opportunities here. And our patients really benefit from it. And really, once they come here, they really love it.
And let's say, I know that breast cancer runs in my family. Maybe I'm more susceptible to it. Would it serve any good purpose to maybe come to you guys, even if I don't have cancer, but I'm concerned about it or I want to take steps to maybe try to prevent it? Do you encourage people to kind of take that preventative step as well?
Sure, of course. We could certainly talk about things that they can be doing to have a healthy lifestyle, recommendations, standards that are out there that they can follow. And it's really the general idea of stress. We want to decrease our stress levels and how to manage that. Stress is going to keep coming at us no matter what, but it's how we cope with that stress. And so different things help that, being mindful, having a mind-body practice like a yoga, good diet, good exercise, social support, financial support, all of those things make us healthy and can help us prevent having chronic illnesses.
Is it ever too late to start a holistic approach to my healthcare? Is there a certain age that I'm like, nope, it's not going to work?
Absolutely not. No, we have the majority, not majority, but lately I've seen a lot of 79, 80-year-old patients that are coming in and engaging in the different opportunities to help manage their stress, to improve their diet, to have, social support. We also have our behavioral health counselor has support groups, which are really helpful as well. So no, it's never too late to start.
Very good advice. Yeah, never too late. Never too late to start changing your life. Well, is there any other best breast health advice that you could give to our viewers out there? And, again, it's on top of mind right now as it is National Breast Cancer Awareness Month. But I mean, this is something that we should be thinking about all year long. So what advice would you give to our viewers out there?
What I'll say is that I know, even personally, that with COVID, it was easy to put off having your mammogram. My office is across the hall from a mammography unit, and I didn't have a mammogram. It was delayed for about a year, but I have gotten back on track, and I want anyone who has delayed getting their mammogram to schedule it. It is so important, and if it is a screening mammogram, you can call and get it scheduled yourself. At Advanced Radiology is the mammography unit across from the breast center, the breast health center. And it's so important to get back on track because it was easy to say, listen, I don't want to go out of my house. I need to do the social distancing. It's time to get back. You can wear your mask. I wear my mask all the time. We're required to. And they will require you to wear a mask when you get your mammogram at Advanced Radiology. But please, mammograms are the most important screening tool for early detection of breast cancer.
And I would imagine too, some people may not do it because of fear, right? They're afraid of what that mammogram might
Of
say.
course.
Maybe they felt that lump and they're like, oh, well, what if this is, I don't want to go down this path. I mean, do you find people who let fear kind of dictate, how they take care of their health?
Unfortunately, yes. Yeah. But we know with studies and statistics that a mammogram is the best form of imaging to detect an early breast cancer long before you can feel it. Generally speaking, we, with our fingertips, generally won't feel something in your breast until it's a centimeter in size, which means, generally speaking, on a very general term, it's been in your breast for a pretty long time, much longer than you would ever anticipate. And so, can that be identified on a mammogram before you can feel it? 100%. Yes. Yeah, it's so important.
Yeah.
And
So, yeah.
any advice from you?
Well, I'm all about lifestyle. And so having the healthy lifestyles that can help to, prevent cancers, breast cancer, any other types of cancers. So it is about a healthy diet. There is research that shows that having a higher BMI can increase your chance of breast cancer. So having a healthy diet and lifestyle can really decrease that risk. Over use of alcohol, more than one drink a day can increase, for women, can increase breast cancer. So doing those preventative type things, living a healthy lifestyle, finding someone, if you come to our dietitian, she can sit down with you and go over what your current diet looks like and look for areas for improvement. And then it's also really interesting when patients have sit down with Lauren, our dietitian, how they have tips that they didn't even think of, or they hear about this new type of omega-3 fatty acids in nuts, and they didn't know how that all comes together, and so simply just adding a handful of nuts a couple times a day can help, support brain health and all over, health. So things like that that lifestyle type stuff, and coming and learning about our mind body practices, the yoga, having healing therapy sessions where you are able to relax the body, help the body get back into a state where its autonomic system is working well again. Because when we go through stress, our sympathetic nervous system, our fight or flight, is engaged. And this is a long process sometimes, going through cancer. And the idea of so you're constantly stressed and your cortisol is rushing through and your hormones are off. And so these relaxation sessions can help to, get the parasympathetic nervous system, the rest, the relaxation, back on track. So your body knows how to adjust as needed, because we still need to respond to stress, but we need to respond healthfully. So those things can all be very preventative and are definitely recommended for women to prevent cancer.
Good. And again, things that, you can take it step by step. Maybe you kind of check a lot of those boxes of some of those things you need to be worried about or concerned about. But if you just change maybe one of them, then that could lead to other things as well. You don't have to tackle the whole list at once.
Yeah. And, I think it's how you manage stress is where you start, because if you're stressed, then you're not going to maybe exercise because you're overwhelmed, or you're going to have stress overeating and not eat a healthy diet. And not sleep well. So, really starting with how you manage stress, which comes from mindfulness, just the idea of being aware of what's going on by taking some deep breaths. Then, again, knowing what's going on, observing how you're feeling, what's happening in the environment. And then you're in tune with what your body needs. And so you can plan how you want to proceed. Do you want to proceed by yelling and screaming at somebody, or do you want to proceed by smiling and wishing them well, which just calms everything down and really affects the whole body.
Makes all the difference. Well, very good. Well, this has been a wonderful discussion. I've learned so much here in the last 25 minutes or so. We've been talking your ear off for a while. So if people would like more information about the services that are offered through the Cancer Institute, the Breast Health Center, where can we go to get some of this great information?
So to the University of Maryland St. Joseph's Medical Center website, that is a great start. Our Wellness Center, our number is 410-427-2598. And our wonderful Yolanda will answer the phone and just take you from there. Susan can attest to that.
She's
She
wonderful.
is heaven sent.
Yeah.
All right, go Yolanda. Very good. All right, and of course, we will have this whole Facebook Live discussion posted on the WMAR2 News Facebook page and the YouTube page as well. So if you're just joining us or you missed a portion of it, please go back and take a listen, because we really did talk about some really fantastic ways to have this holistic approach to our care, making sure we're taking care of not just our breath, but our bodies as well. So Ginny and Susan, I just want to thank you again so much for taking the time to talk with us today. Really appreciate it.
Thank you, Megan.
Yeah,
This is
thank you
fun.
for the opportunity. Now go get some rest.